chiropractic, and I have one of my experts.
Yes, hi, I'm Dr. Holly Hernandez. I am a pelvic floor physical therapist and the owner and founder of Lotus Rehab here in San Antonio.
Awesome. So what is a pelvic floor physical therapist?
Yeah, so a pelvic floor physical therapist is a PT who specializes in the pelvic floor muscles, which are the muscles inside of the pelvis.
Okay, so as a pregnant mom who's in her 3rd trimester, why would I need to come see you?
Yeah, so I do see a lot of women during pregnancy and postpartum, and the benefits of coming during pregnancy is to, number one, assess movement as our body changes, because pregnancy can definitely play a big role on our pelvic floor and on our core. And so learning a lot of this information and having this assessment during pregnancy can set you up for birth preparation as well as healing postpartum and maintaining strength during pregnancy.
Okay, wonderful. I want to kind of go over some of the myths or some of the fears that I think that are just we learn as a society. Once you get pregnant, you're like, oh, you know. So the first thing, urination with sneezing, coughing, laughing, it's a thing.
Yeah.
And it's not just postpartum.
No.
It happens during pregnancy.
Yeah.
So one, why does it happen?
Yeah.
And two, what do we do about it?
Yeah. So as you move through pregnancy, there's increased strain and stress on those pelvic floor muscles. So they're having to work a whole lot harder against all of the weight of baby, placenta, and everything in the abdomen. And so as that increased weight happens, sometimes we get a little less efficient in our pelvic floor muscles. So leaking is so common, so common, and something that I see regularly. And there are some easy tips, tricks, and ways in which we can reconnect into this space in order to address leaking. And typically it's not something that's just going to go away. There are a lot of resources out there to strengthen your pelvic floor muscles, but also so often I get women that come in here that say my pelvic floor muscles are weak and that's why I'm leaking. And it's not always the case. These muscles can be tense and tight.
Right.
Or they can be weak and loose, but I would say more often than not, I find that we're not quite connected in with how to relax our pelvic floor muscles and then to be able to effectively contract them to prevent leaking. And so the urethra actually runs through the vaginal canal, and so when we do a Kegel or a pelvic floor muscle contraction, it squeezes and lifts in order to close off that urethra so that we don't leak urine. And so sometimes we're squeezing either too much in the back, not enough in the front to really get that urethra to close, or our pelvic floor muscles are tense, and then when we go to contract it, we can't go anywhere.
No wiggle room.
Exactly. So one of the biggest takeaways I have for people is we have to work on both length as well as strength. And so I think people talk a lot about Kegel,
Yes,
but nobody ever talks about the release or the relax or the lengthening component of the Kegel.
Okay, so going into that, will you kind of maybe demonstrate just a quick breathing technique and how to do the breathe in? Do you strengthen? Do you lengthen? Do you loosen?
So what is it? So breathing is really a huge part of it. If you can picture right here your diaphragm, which is your main breathing muscle, and then down in here your pelvic floor. So the way in which it should function is that as you breathe in, your diaphragm flattens out, and then the pelvic floor should kind of take up some of that pressure or relax this way. If you can imagine like my hand lengthening down, and then as we exhale, it should come back up. But oftentimes when there's dysfunction, leaking, pelvic pain, holding a lot of tension, this coordination becomes backwards. And so easy is just work on that breathing technique of breathing in through your diaphragm and through your ribs. You've heard of diaphragmatic breathing. Letting ribs expand, belly comes along for the ride, and then relaxing your pelvic floor, thinking about your vulva opening or expanding. Now, it's not a bear down or a push down, but it's just this idea of softening, not holding tension. And then as you exhale, squeezing and lifting, because it makes sense.
So not just squeezing,
squeeze
but that lift.
And lift. Think about pulling a blueberry up inside of your vagina, or like you're sucking a milkshake up through a straw with your vagina, right? All the little cues. And so So as a pelvic floor PT, that's one of the things I assess. With my fingers, I can feel.
So you actually do go in there and assess the vagina and the muscles inside the pelvic floor.
Yes,
Okay,
yes.
Wonderful.
So we're trained to actually assess those muscles, whether it's intravaginally or interrectally, and then we can give cues on how you're doing with that squeeze and lift, and help with some of that urethral closure so that you're not leaking.
Right.
But think about it. If I'm sneezing, achoo, coughing, those are all exhales. If I'm not coordinated with this breath, then I'm gonna go achoo, and I'm gonna leak. So just some little things like that can be so helpful to say. Kegels, yes, those are great to strengthen your pelvic floor, but can you do your Kegel as you exhale? Shh, as opposed to just squeezing.
Yes, because that's something I hear in my office all the time. It's, moms complaining about how embarrassing it is to sit somewhere like a leather chair and they get up and there's a stain, right? Or they're at a party and they're laughing so hard, and to themselves they're thinking, oh my gosh, I'm peeing myself. No one else knows. So it's nice to be able to do an activity that's strengthening that you don't have to go to the gym for. You can be in your car driving, and you're just breathing, but you're actually strengthening properly.
And I highly recommend getting some sort of assessment in this space, because so often I have people come in and say, it's because of weakness that I'm leaking. But I would say so often it's about tension, because if you can think about just like a hand, if I'm squeezing, I'm not getting very effective. Versus we need to get some, if I constantly walked around with my arm like this, my arm wouldn't be very functional. And so it's the same in the pelvic floor. And I think so often we miss this component of lengthening and strengthening. And so that's where it can be so helpful to have an assessment personally to know what's going on in your pelvic floor.
Yes, and then, so going off of that, when we think of PT, usually you hear, oh, I go 3 times a week, I go 5 times a week. But since you do a little bit different work, right, because it's not like an injury. I was in a car accident. I didn't get shoulder repair done or anything like that. So how often do people come see you, or do they have to come see you? And what does that look like? Obviously, everyone's different, but what's like a general idea, so that we also get away from the fear of PT all the time?
Yes, and so very often in my clinic, I'm not seeing women consistently 2-3 times a week over 6 weeks. Now, there are cases in which I will tell people, if we're struggling to connect into the space and do a contraction of this space, it might be a little bit more frequently, but oftentimes when we're talking about during pregnancy or just connecting in or wellness, oftentimes it's just some education, 1, 2, maybe a follow-up visit here and there can make the world of a difference, especially if you're already doing a home some kind of exercise routine. You can add this information into what you're already doing.
So you come in, connect the dots. That's really what it is, right? It's, okay, I think I'm doing it. I don't know. Can someone assess? You get the assessment, and then you're like, oh, it clicks, right? And then you go home, you apply it. If something's needed, like you said, if there's more disconnection, come back for more care. Now, talking postpartum a little bit, I know another fear people have is sex. When can I have sex? Is it okay to have sex? And just the fear of this baby ruin my vagina. Like I'm bleeding, or it's not the same, or I won't feel it the same. Tell me about that.
So returning to sex postpartum, number 1, you want to get clearance from your medical provider. You do have a wound inside of your uterus, and so that's where the bleeding comes from, and so allowing that to heal. But I oftentimes see women, especially when we're talking about tearing in the perineum, stitches, maybe some pain in that space, it can cause a lot of anxiety in returning to intercourse. And so through pelvic floor PT, we can release those muscles, release the scar tissue, and just even prepare that space in order to allow for that lengthening. Because in order to have penetration inside of the vaginal canal, we have to be able to relax those pelvic floor muscles. And then I always tell my clients lubricant. Lubricant can be so helpful postpartum, just to allow for ease and comfort as you return to intercourse postpartum.
Okay, wonderful. And lastly, I want to kind of go over diastasis recti.
Yes.
We hear that word a lot, the abdominal separation, and there's this fear of don't do planks, don't do sit-ups, or do all the planks, all the sit-ups.
Yes.
What do we do?
Yes.
What's right?
Yeah, so diastasis is one of those topics of the conversation that I see both ends of the spectrum, and I think there's really just some misinformation and not a lot of really great research about it, even from professionals. And so I think, number one, understanding that 100% of women have a diastasis at the end stages of pregnancy. It is sort of our body's way of adapting to growing baby inside of our body. So to lose some of the fear that, oh, I have a diastasis, because it is a physiological norm that happens to accommodate baby. And then number two, understanding, exercise during pregnancy is going to look different than exercise before pregnancy, and understanding those risks versus benefits and weighing that out for yourself is going to look very different for somebody that's a CrossFit athlete versus somebody else that's sedentary. So we can definitely help navigate through that. And there are, some general rules of thumb that we're not wanting to work out to our maximum during pregnancy. And then also understanding that, sit-ups and planks, while they're not bad, and it's not the same for everybody, we have to be aware of what's happening in this abdomen without having fear of movement.
Right.
So often I have people that come in, I have a diastasis and I don't want to move. Well, this tissue is strong. We need to load it in order to strengthen it. And so I think that that's a huge piece that's oftentimes missing in the community. And then also progression,
working your way into it.
Yes, it's we can't expect to go to the gym and pick up the 100-pound dumbbell. We've got to start somewhere and then progress ourselves as we move. And so figuring out ways of what feels good and then progressing yourself into maybe something that you want to be able to do.
Wonderful. Okay, so lastly, for any of our viewers that aren't local, where should they seek help? How should they seek help? And what is your takeaway message?
Definitely. Well, there's a wonderful directory called pelvicguru.com that you can go onto and get a list of pelvic health providers. And that can be a great place to find a local pelvic floor physical therapist, sex educator, or physician that is specializes in the pelvic floor. And so that can be a great resource. And then Pelvic Guru also has a number of handouts and information that you can seek out as well. There is an array of pelvic floor knowledge and info out there, and so it's hard to just direct you in one place. But one of my favorites is Mama Strong. She has a $5 a month class that you can do online that's really helpful at just getting you moving and sort of helping through this transition during pregnancy and postpartum.
Wonderful. Well, thank you for sharing that information with us.
Of
We'll
course.
attach her information below the video, and so that way you guys can check her out.
Beautiful. Thanks so much for having me.
Bye.